As you know, some of your benefits will be changing in 2015. This presentation has been developed to help you understand why the changes are being made, who will be affected, which benefit plans will be affected, and what you need to do to ensure you have the coverage you need for 2015. Let's begin with why the benefits are changing. As a Department of Energy contractor, UCOR is required to complete a study every 2 years, comparing the value of its benefits with other DOE-selected employers. This year, the ETTP benefits exceeded the DOE limits, which means that our benefits must be brought in line with the other comparator companies. We know how important your benefits are to you, and we took a careful look at how to meet the DOE limit while preserving the value and protection for our employees. We even included employees on the study team to represent your concerns and interests. The ETTP plans cover a wide range of employee groups, so let's look at who these changes apply to. For 2015, you may experience changes to your medical, dental, short-term disability, long-term disability, and optional life insurance benefits. Changes will be reflected in plan coverage and employee premiums. Additionally, the 2015 dental carrier will be MetLife. We'll go over those details later. Whether these changes will affect you will depend on what type of employee you are. Let's take a look at the different categories of employees and how the changes will affect each one. Active salaried employees will be affected by all the changes we will talk about here. Active bargaining unit employees will be affected by the medical plan rate increase, the dental plan rate increase, and the change in the dental carrier to MetLife. Pre-65 retirees have medical and dental coverage only, and they are affected by all the changes. Some pre-65 retirees who are eligible for voluntary life insurance will be affected by the premium adjustment. The only change for post-65 retirees will be the annual rate increase. You will not see any changes in 2015 to your retirement plans, including pension and 401k retirement savings. UCOR employees will not have any changes to their paid time off and paid holiday schedule. And finally, we cannot emphasize this enough. This year is a participative enrollment, which means you must enroll to receive coverage in the medical and dental plans, LTD buy-up, and, as always, flexible spending accounts. You can enroll either online or by phone through Mercer Single Source One. The enrollment site will be available beginning November 10th through November 25th. Don't get caught without coverage on January 1st, 2015. Before we talk about the changes to the medical plan, let's look at some terms that are important to understanding your coverage. A PPO is a medical plan that lets you choose whether to use providers in the network or out of the network each time you need care. You will pay less when you use in-network providers. The deductible is an amount you pay before the plan pays benefits. Once you have met the deductible, you will pay part of the cost for medical services. Some services have a copayment, which is a flat dollar amount for a specific service, say $30 for a doctor's office visit. Other services have a copayment and coinsurance, which means you pay a flat dollar amount and a percentage of the cost for services. The annual out-of-pocket maximum protects your wallet by limiting how much you will pay for covered services in 1 year. This includes your deductible, copayments, and coinsurance amounts. Once you reach the out-of-pocket maximum, the plan will pay 100% of covered services for the rest of the year. Enrolling in a pre-tax healthcare flexible spending account, or FSA, lets you pay for healthcare expenses your plan doesn't cover. These expenses include your deductible, copays, and coinsurance. Let's take a look at the 2015 changes, starting with your medical plan. Aetna will continue as the carrier, and the plan will remain a PPO with coverage for both in- and out-of-network care. What's new here is that prescription drugs will be covered only at in-network pharmacy providers. That means the plan will not pay for prescriptions filled at a provider that is not part of the Aetna network. For 2015, the deductible will be $400 for single coverage, $800 for family coverage when you use in-network providers. For out-of-network providers, this increases to $1,000 for single and $2,000 for family. Let's look at coinsurance. Once you meet the deductible, you will pay 20% of covered service in the network. The plan will pay 80%. Out-of-network, you will pay 40%, and the plan will pay 60%. The out-of-pocket maximum, which is the most you will pay each year for covered services, is $5,100 single and $10,200 family in the network. As you can see, it is significantly higher for out-of-network providers. Keep in mind that preventive care, including annual physicals and certain screening exams, are covered at 100%, no deductible, both in and out of the network. When you have a doctor's office visit, you will pay a copayment. You do not have to satisfy a deductible or pay any coinsurance. Some services require a copayment in addition to coinsurance and any deductible amount. These are inpatient hospital care, outpatient surgery, emergency room care, and visits to an urgent care facility. The complete details of how much you will pay are on the 2015 Benefits Overview, which is available on the Benefits website. This chart shows the services that require a copayment in addition to your coinsurance after the deductible. So, for example, if you receive care at an emergency room, you would pay a $200 copayment in addition to any deductible you owe. If you have already satisfied your deductible, you would pay the $200 copayment plus 20% coinsurance. The plan would pay 80%. Beginning in 2015, prescription drugs will be covered only when you use Aetna's network providers. There is no coverage for out-of-network providers. There will be a $100 deductible for single, $200 for family coverage, after which you will pay 30% and the plan will pay 70%. This coverage also has an out-of-pocket maximum, which is $1,500 for single coverage and $3,000 for family. This out-of-pocket maximum is for prescription drugs only and is separate from the medical plan's out-of-pocket maximum. How much you and the plan will pay for prescription drugs is based on 4 tiers: generic, non-generic formulary, non-generic non-formulary, and specialty. Again, the details are in your Benefits Overview. Now let's put it all together so you can see your medical plan and pharmacy coverage together. Remember, your plan will only cover prescription drugs at in-network providers. There will not be coverage for prescriptions filled out of the network. Also, prescription drugs will be subject to a separate deductible and out-of-pocket maximum. To assist in minimizing the potential impact of your out-of-pocket medical costs, consider enrolling in a healthcare flexible spending account. The FSA can save you money by letting you pay for medical care with tax-free dollars. If you are an employee of a company other than UCOR, please contact your HR benefits administrator to see if your employer offers this benefit. Let's move on to the dental plan for 2015. First, MetLife will be the new insurance company, so your network of providers may be new as well. Please check to ensure your dental providers are in the MetLife network. During the annual enrollment period, you must either elect or waive dental coverage. Beginning January 1, 2015, you will experience a change in your payroll deduction based on your election. Rather than paying 20% of the premium, active, salaried, and pre-65 retirees will pay 40% of the dental premium. Dental rates will be posted in the Mercer Single Source 1 enrollment system. The benefit provisions under the dental plan remain the same, including 100% coverage for preventive care at any dentist, in or out of the network. Keep in mind, you may pay more out-of-pocket costs if you use a provider that is outside the MetLife network. The next benefit applies to UCOR active employees. Short-term disability supplements your income if you are unable to work due to an illness or injury. Effective January 1, 2015, eligible active salaried employees who are newly certified for short-term disability must use PTO for the first 40 hours of their absence. After receiving MetLife certification, the STD plan will supplement 60% of base pay up to the remaining 175 days. You may continue to use PTO to supplement your STD benefit in order to receive up to 100% of your base pay during your absence. For eligible active salaried employees who remain unable to work after STD benefits are exhausted, approved long-term disability benefits continue to provide income. Effective January 1, 2015, the company-paid portion of the LTD plan will provide a benefit of 40% of basic annual earnings. During the 2015 annual enrollment, you will have the opportunity to elect, at your expense, an additional 20% of LTD coverage. Election of the 20% buy-up option plus the 40% company-paid benefit would provide a total LTD benefit of 60% of your basic annual earnings to a maximum of $6,000 per month. If you elect the 20% buy-up option during the 2015 annual enrollment period, you will not be required to provide a statement of good health in order to receive coverage. If you choose to elect the buy-up option at a future time, an approved statement of health will be required before coverage will be issued. Let's take a look at how much the LTD buy-up will cost and how to figure out your cost. The employee monthly premium will be 28 cents for every $100 of monthly pay you cover. Here's an example. Let's say you earn $38,000 a year. Divide that number by 12 to get your monthly pay amount. Then divide your monthly pay by 100 to get the value per $100. Then multiply that number by the premium amount to get your monthly cost. The cost for optional employee life insurance will be adjusted in 2015. The amount of the adjustment depends on your age. The premiums are listed on the Benefits Overview and will be shown in the Mercer Single Source 1 enrollment system beginning November 10th. If you already have optional employee life insurance, you do not need to make a new election during annual enrollment. Your current coverage will automatically continue at the adjusted rate. There are no premium rate changes to optional dependent spouse or dependent child life insurance. There are many resources available to you if you have questions during the 2015 annual enrollment. For general plan design and enrollment information, contact the Mercer Single Source 1 call center at 888-890-5255. 5631. For more detailed information on plan coverage, contact Aetna for the medical plan information, MetLife for dental plan information, and Vision Services regarding vision benefits. Also, more plan details and premium rates are available on the company's intranet. And finally, we cannot emphasize this enough. This year is a participative enrollment, which means you must enroll to receive coverage in the medical and dental plans, LTD buy-up, and, as always, flexible spending accounts. You can enroll either online or by phone through Mercer Single Source One. The enrollment site will be available beginning November 10th through November 25th. Don't get caught without coverage on January 1st, 2015.